requires that you have a system for managing, in other words, monitoring the performance of the nurses in working with the physicians and the patients and providing feedback to them so that they know, and basically a quality improvement program for the nurses to make sure that they're continuing to stay focused on the elements that have been shown to be the most effective in producing the goals that we're all trying to achieve. And finally, financial rewards or incentives for desired outcomes would be a highly desirable feature, although we didn't do it in our study. But we found that if the physicians see the nurse as a valuable asset that's going to help them to achieve what they're trying to achieve, and even perhaps increase the amount of their bonus at the end of the year, they're going to be much more inclined to develop really tight, effective working relationships with the nurses, and that's so important to have that effective, smooth teamwork between them. So in a case where the physician does not have any particular incentive other than just, say, professionalism, the physician may more or less tolerate the nurse working alongside him or her on these complex patients, but not really integrate so much. But if the physician sees the nurse as a valued partner who can help the physician to achieve either better quality that results in a higher pay, better satisfaction, patient satisfaction, or some sort of a financial incentive related to reduction in utilization, these are all motivators for helping the physician and the nurse to work smoothly together as a real partnership. So that's the end of my prepared remarks, and I'll throw it open now to questions. I think maybe Amy has some questions.